helping make your life easier. Moms Every Day.
Welcome back, everyone, to Moms Every Day. Today we're joined by Kathy Cunningham of Cabell Huntington Hospital. Kathy, thank you for being here with us today.
Thank you, Taylor.
Today we're talking about the hospital's chest pain accreditation program and also heart attack pain. So this is obviously a topic that affects a lot of people in our area. Tell us about your accreditation program and what that means for you all at the hospital.
Well, the accreditation that we have achieved deals with taking care of the entire spectrum of cardiac patient, from the person who walks into the hospital with chest pain or other signs of acute coronary syndrome that may or may not be heart attack, but you don't know until you're tested, all the way up to the most acute life-threatening heart attack.
What does that mean for the people who may be dealing with this, that you all have that accreditation?
Well, this means that our accreditation, by the way, is through the Society of Cardiovascular Patient Care, which is the accrediting body of the American College of Cardiology, and they're the authority in North America and internationally for cardiac care. It means that we have achieved a very rigorous set of standards in the care of the patient, from the low-risk chest pain, again, all the way up to the most acute heart attack. We can bring you into the hospital and either rule out that your symptoms are not cardiac, or we can take care of your heart attack immediately by inserting stents into the blocked vessel that's causing the heart attack.
Sure. Now, sometimes symptoms of heart attacks can be hidden. What are some of those symptoms and signs that people should look for?
You're right, Taylor, and there are three groups in the general population that very often have atypical signs. That means they don't have that Hollywood heart attack where they have crushing chest pain, and those groups are women, diabetics, and the elderly. And some of those signs in those groups are very vague and very atypical. They are sudden onset of shortness of breath that is way off baseline from what the person usually experiences, sudden unexplainable fatigue, some aches and pains that you might not describe as pain, but just as pressure perhaps in the chest, the upper abdomen. And if people experience those kinds of signs and symptoms, we want them to talk to their doctor about it and get early care. If they have those signs and symptoms that aren't going away after 15 to 20 minutes, they need to call 911.
And you just mentioned calling 911. That should always be the first option. Why is that so important that they call 911 and not wait or try to take things into their own hands?
We have a lot of people that say, oh, I can get to the hospital quicker than an ambulance can come get me. However, it's very, very important to call 911, not just because the medics can take care of you in your house sooner, but the most important thing is that EKG that they're going to perform on you on site in your living room within 10 minutes of their arrival is going to be transmitted electronically to the emergency department. The doctor will look at that EKG and say, yep, that's a heart attack. He will activate the cath lab, and probably before the patient even gets to the hospital, the cath lab and the cardiologist will be there ready to open that blocked artery.
So they're already prepared. Of take us through some of the steps of the care and the attention that people can get if an ambulance does show up to help them.
The ambulance crew, which consists of paramedics, and they are all highly trained in looking at EKGs and knowing there is a very specific waveform that's indicative of a heart attack. And even if the transmission system is down, they can pick up their cell phone or their radio and transmit that information to the ED and tell the doctor, I have a patient who has signs of a heart attack. The EKG looks really bad. Can you activate a code heart? That's what we call the activation of the cath lab and the cardiologist. And the ED doctor will activate the code heart before the patient ever arrives at the hospital. A lot of times, if we're there before the patient gets here, the patient doesn't even stop in the emergency room. They go straight to the cath lab. And so time is of the essence in a heart attack. And the reason is, if you have a blocked artery that feeds that heart muscle, there is no blood getting to that heart muscle. Therefore, there is no oxygen getting to that heart muscle. No oxygen means cell death. And the longer that goes, the more chance you have of ending up with heart failure afterwards. There's about a 2-hour window from the time that blockage occurs until the time we get that vessel open to where you will not have permanent heart damage.
So time is key. And quickly, if you don't mind, kind of explain to people at home, what are some things they can do to hopefully prevent a heart attack?
Well, of course, we all know that we should do the things we can change.
Sure.
We all have hereditary factors. We may have a family history of heart disease, but we all know we need to have diet, exercise, take the medicines the doctor talks, and work with your doctor. Don't feel like you're just doing what your doctor tells you to do. Become part of the care team.
All right, Kathy, thank you so much, and thank you all for joining us today. If you'd like more information, head over to WSAZ Mobile and tap on Moms. Have a great day.